We're so glad you've joined us today for BRMC's Healthy Connections. Lori King McCracken, I always get that hyphenation in there, is with the First Step program that's over at BRMC. So Lori, would you please tell our viewers what First Step, what the program is all about?
We help people who are suffering from the addiction of pain medication, alcohol, and some street drugs.
And some street drugs, okay. And right now it's the beginning of a new year. It's time maybe for a new life.
Some big New Year's resolutions.
Okay, all right. So I think you were real busy in 2011.
We were. We were very busy. People wanting to get their life straight, get their families put back together, and start saving money.
Mm-hmm. Stop spending it on all those drugs, folks. So put it away for something healthy.
For like a summer vacation.
You bet. You bet. Talk to me about how that works with, if someone wanted to contact First Step at the hospital, how would they go about doing that?
First, our phone number is 508-7590. A person they can call themselves. Also, we take referrals from physicians, from pretty much anyone. It is an elective service, so the person must be willing to come in. We kind of get a history of what's going on, what they've been using, how long, and to find out, do they go through withdrawals? Because that's a big thing. You have to go through withdrawals in order for us to medically treat that individual. Also, there's a financial aspect. Is there insurance? We do take Medicaid, Medicare, private insurance, as well as private pay.
A lot of private insurance will pay for getting their employee that they've invested a lot of money in.
And we're seeing more and more of that. We're seeing more employers sending their employee because they do value them, and we know that it's very expensive to replace an employee. We're also seeing more referrals from the court systems.
Okay, yeah. I'm afraid probably it almost always seems to go hand in hand that for those that are having real economic struggles as they go down, sometimes abuse, I'm thinking primarily of alcohol maybe versus street drugs, but that sometimes comes into play when people don't know how to cope with the situation life has placed them in, so they unfortunately turn to something like excessive alcohol
or pain medication. And one thing about going to treatment, 99% of the time, before you can go to treatment, you have to go through some sort of medical detox, medical stabilization, because the treatment facilities don't have medical staff to assist the patient if there was a complication. So we're going to get the patient through that.
Get them over that real hump of...
Through that acute medical stay.
Okay. So I know that at BRMC, the hospitalists actually do the patient care, the bedside care, and then they would go ahead. Someone comes in, gives you a history, you sit down with them, you go over all of this information, and I'm sure they're scared.
Always scared.
Going to always be scared, but you reassure them that yes, you're going to go through some withdrawal.
We're going to treat your symptoms.
But we're going to treat your symptoms.
Yes.
Right, so that it's not going to be that what we've all seen in the movies, thrashing around.
Yes, we do treat their symptoms, and we keep them as comfortable as we can. A lot of people, they don't want to leave, and we always say, we're not the spa. We're pretty close to the spa, but we're not the spa.
That's good customer service. That's wonderful.
But we have the new in-room dining service that the hospital's offering, and our patients absolutely love it. Because they feel like they're so taken care of. They can just, pick up their call, light, and call the secretary, and order their food. Some of our patients are just so delighted to come to our hospital and be treated with such respect, and they just are all the time. I'm, telling my friend, great, tell all your friends,
tell all your friends that have drug problems. Come on down.
Come on over here.
We'll get you over it. We'll get you out of it.
Yes, with great respect.
Yeah. Well, and I think there's always a huge misconception with folks that it's lower incomes necessarily that are going through
and
some
that is
sort of
absolutely
addiction, and that is not
false.
true.
Yeah, we have people would actually be surprised. It doesn't matter how much money you have and how old you are. Yeah, everyone has some sort of problem.
And you were saying during the break that there's a few things. Now, you can't take pregnant women.
We don't take pregnant women, and we also do not take people who are on meth.
Okay.
Methamphetamines. We don't have a protocol to treat
to
those.
do that. Okay. So you can treat anybody that's on painkillers that has maybe gone way too far with those.
Right.
And that's a lot of our elderly.
And just after a common surgery, or just take, I hurt my back and my doctor prescribed, X, Y, and Z, and I've, ran out of meds. Why is my body going through this physical change? Well, it's because you're going through withdrawal.
Yeah. So it was something you needed at one time, but now you don't. But your body's still telling you,
right,
hey, we still want this. It was making me feel pretty darn good. So, yeah. And I know I'd mentioned that a lot of elderly go through this, and there's no shame nor stigmatism that should go along with this, because this is something that happens oftentimes with people, and we're here. First Step is here, BRMC is here to make sure that folks get the help they need. And as you said, very respected.
It's very private if that's what they like.
Professional. Where do you draw from?
Here recently, it seems like we have drawn more from the court systems.
Local court systems or just courts? I
would say within 60 miles.
Okay.
We are trying to expand our marketing closer to Branson, the Missouri, between Harrison and Branson, and then between Harrison and Marshall, trying to get the word out. We do have a couple radio ads, and we have our billboards, and because we want everyone to know.
And more coming.
More coming. We want everyone to know and be aware, because I think there is such a need for this service. We've serviced people from Oklahoma to Missouri, from Chicago to our own state here in Arkansas. So.
And it's a 3-day, roughly. That
typically
may change.
3 to 5 days.
Yeah. And someone, if they are really concerned about their coworkers, their employer knowing about this, could come in, could prearrange everything, and come for, let's say, a long weekend. And
right. Usually a Friday. A patient comes in on Friday. It works out better for them because they don't have to miss work, because they do have family that they have to take care of. So they come in on Friday, and we can discharge them first thing Monday morning.
Does everyone that's discharged then, that kind of brings up a question, many will go then into a 30-day program someplace for more?
We like for everyone that we talk to, we always encourage to have a discharge plan. We feel like that's very important, because when you come in, you have to look at the future, and you're going to start with a whole new life. So we always like for the patient, we work with them, get a discharge plan. We're going to get a treatment. Are we going to do counseling, outpatient? What are we going to do?
Right.
And so we kind of work backwards. If a patient plans to go to treatment, we like to get that treatment set up, get that date scheduled, and then we can get our date scheduled. Because we're a little more flexible than a lot of treatment facilities.
Are they overcrowded?
They are.
Yeah, I was going to say they probably got a waiting list.
There's a waiting list like you wouldn't believe.
Yeah.
And a lot of treatment facilities don't take insurance. So people have to plan, for the financial part of it, if that's what they're planning on doing. There's all sorts of treatment facilities out there. Some range for 30 days and some range for
90.
A year long.
Really?
There's lots of different options out there for people.
I know that it's one of those controversial issues as to what works best with an addict. Okay,
right.
What is it that's going to, and 30 for some and 90 for others, a year, as you said.
And some people truly need that year to completely relocate and, just start a whole new life.
There's one program I know that is a year program that I want to talk about as soon as we take a break. So let's talk about that. That year program has me quite fascinated, and the concept behind it. So we need to take a short break. Don't go away. We'll be right back talking with Lori King McCracken from First Step that's located in BRMC.